All right, folks, I'm super excited to talk to today's guest. I'm joined by Professor Helen Payne. Helen has a huge background, history, knowledge in working with people, but also researching on all things to do with movement and psychotherapy. And I'm just very excited to talk to Helen today because she has the clinical experience, but also the practical experience working and helping people. So, Helen, thanks so much for taking time out of your day today.
I'm delighted to be here and thank you, Connor, for the invitation.
Great stuff. So, Helen, I heard about you initially because of your TEDx talk. I think it was back in 2018, but also my friend put me onto your book, which is would have been in the 90s, 92, I think it was.
I've done I've done about 12 books now. Yeah, the
Wow.
first one in 1992. Well, I did one in 1990, which was creative movement and dancing group work. And that was a sort of a book which gave lots of examples of different practices you could do with different populations, developing them um, and ideas really for a starter handbook really. And then the book that I showcased the UK um, dance movement psychotherapy practice in a book called Dance Movement Psychotherapy Theory and Practice. And then the next book was Theory, Research and Practice. In that one, I showcased even more UK practitioners. And then I did an international book called Essentials in Dance Movement Psychotherapy. And that's showcasing international practitioners and theoreticians and researchers.
Okay, and for people to just know a bit more about your background, your information, like how you got into this whole area, do you want to explain like how it all started?
Okay, let's go back a long way. I think the first hook was when I was working. I was a student, a phys ed student, um, and I worked in the holidays to buy a car to earn money to buy a car. I worked with a recreational therapist in an hospital where the patients were mostly non-verbal and they had either profound or severe learning difficulties. And he took me around with him and to do his work, which was only in the holidays. So it was only, the 6 weeks in the summer and a couple of weeks Easter and Christmas and so on. But it was really interesting because he was using non-verbal approaches, using balls and bean bags and other ways of communicating with the patients. And there was a school on site, so he also worked with the children and adolescents in this way. And he was a phys ed specialist who had adapted his background in movement to working with these patients. And I learned so much from him. And I think that was the germ really that stayed with me. It stayed with me for probably the next 10 years, where I found myself in special education, working with emotionally disturbed children who also had a mild to moderate learning difficulty, but they were verbal. Most of them were verbal. There were a couple of echolalic, autistic, but most of them were verbal. But then I found myself making up as a phys ed specialist from the school, which was 3-year-olds to 18. I was the phys ed specialist doing all the different phys ed physical education sessions, but particularly creative movement and dance, which was one of the ways that these children could express themselves. And I could engage with them in non-verbal communication, moving together and making relationship through that non-verbal mediator. Um, and so I started making up what I was doing in it. The head teacher was he'd had a drama therapist before, a well-known drama therapist. So he was sort of willing to let me have a go at making up what I was doing there, improvising really. Um, and then I went away and got a little bit more information. I had a year's sabbatical, and then I came back, and he gave me individual and group sessions with these children and adolescents. And then a dance movement therapist from USA came over and found me and filled me, and then told me what I was doing was dance movement therapy. So that's the first label I got for what I was doing. This is what you're doing. You're not doing psychomotor therapy. You're doing dance movement therapy, as she called it. That was back in the 70s.
Wow. And like making it up and then someone telling you you're actually doing something that's already a therapeutic practice, like, was that just how did you figure that out? Like,
I
where
don't
was that
know.
coming from?
Because the children demanded it of me in a way. They weren't really able to express in language their thoughts and feelings, but they often had adverse childhood experiences, early childhood difficulties and so on. And because they had also a learning difficulty, the emotions were very dysregulated. And this was one way that we could find a way to be together. Um, so yes, it was just a natural process. I'd always been interested in improvisation through movement. My background, my mother was a ballerina. I'd always been interested in dance, although I never wanted to do ballet. I gave that up, but I was interested in the creative, expressive use of movement, and that's one of the things I learned at the phys ed college was Laban-informed Laban method of movement. Rudolf von Laban, who developed a particular methodology whereby children's expressive movement was, if you like, honed into making dances together in groups or individually. And that
Yeah.
was my training in Laban dance and also in Laban movement analysis. So observing movement and then categorizing it and so on.
And
And then I
Laban
went
movement was that was the type of practice and training you were doing in phys ed, was it?
Yes, that's what I was doing with the children. Initially, it came out of that background. So I had got those skills. I had got that understanding of movement myself in my own body. Um, and so I could pick up on their movements more easily and either mirror them back or take them a bit further in those and gradually begin this relating together.
And with the types of kids you were dealing with, before we went live, you were talking about working with children with ADHD, autism, or people, anxiety and depression. Do you see patterns? Is it like early childhood trauma that's kind of causing these issues, or have you
No,
seen any patterns?
no. Often ADHD and or autism diagnosis is hereditary. It's in the family somewhere, um, but it compounds childhood development because I was just working with somebody the other day, and it, it was very clear that there's been a lot of negative experiences at school because there were many times where he got it wrong, or he was being told off, or she was being, you know, told it was you're not doing this correctly. This behavior is acceptable, and so on and so on. So there's a lot of feelings of failure at school, and this of course compounds then the emotional dysregulation. So it's very tight, it's all very entangled, the diagnosis and the symptoms of that particular condition, and then the emotional dysregulation. You can't really separate them out because ADHD and autism is part of who that person is. They're not defined by it, but it's part of who they are. And everybody's different as well. There are some similarities you can identify, but the way that people are, it's very different. You met one autistic person, you met one autistic person. You can't generalize on those things. But people do come to psychotherapy because they feel there's something more, there's something deeper. And even if they're on medication for, say, ADHD, um, that can take off the edge and sort of help them to focus and concentrate more. But then there's something more that they need to address, and that's why they come to psychotherapy. There's something deeper they want to uncover, they want to surface, and address and process and integrate.
Yeah. Have you seen any changes with the increase in technology use over the last like 10, 15 years with more frequent cases,
Mm,
ADHD, all these things?
mm, mm. Yeah, yeah. There is more now. The diagnosis has increased rapidly for adults and for children, and particularly for girls, because years ago girls didn't have autism or ADHD, it's only boys. because they were quiet, withdrawn, probably weren't acting out in the same way as maybe the boys were. They weren't noticed, but they would still have the condition and still struggle. But nowadays, it's far more adults are getting diagnosed. In my practice, I've probably seen now 5 or 6 adults through their diagnosis, working with them, as they go for diagnosis, wait for the diagnosis, and then come out with a diagnosis and then go on their medication and so on. Because
Do you
it's
think
quite a big
that's,
transition, but they always knew there's something not right. It was just validating. It was just very validating.
and then what's your opinion on maybe someone's struggling, they can't concentrate, they know something's wrong, the impact of the label, do you think that's helpful because it allows them to know there's a way out? Or do people also maybe over-identify with the label, I'm broken, I can't do anything about it? Like, what
Mm,
advice do you have for people in
mm.
that category?
In my experience, people are relieved to get the diagnosis because it validates what they already knew. And but there's always a doubt before you actually get some authority saying this is what you've got. But they recognize it, they read about it, they do the tests online, they recognize it. Um, yeah, the idea that you're broken, it can't be fixed, I don't think that's very helpful. Um, we want neurodiversity. We need neurodiversity. These, neurodiversity allows for diversity. It allows for different ways of thinking, and it really it helps with creativity. I mean, people with neurodiversity are very often the most needed people in companies, because they do think outside the box. They are diverse in their thinking. They are creative. They have masses to offer and contribute, and we need that diversity in our society. Um, I don't see it as something being broken. I see it something as being an additional,
Yeah,
something extra to offer, actually. Um,
I,
it can
I
be a
do,
struggle for people. I appreciate that, but there's a lot of positives there too.
yeah, I can't remember where I heard it, but they were saying that there's a higher concentration of autism in Silicon Valley because they were saying there's a higher concentration of people who
Mm,
are, uh, have autism or
yeah,
some in that category.
yeah.
Kind of
Yes,
line what you're saying.
quite a few people I've seen with the diagnosis do have that technological background. Yes,
Yeah, like seeing things more creative that maybe someone who isn't on, in that area.
indeed,
Okay.
indeed.
Okay. What would be like a common treatment practice you work on from a movement, a dance side of things with someone who is struggling with ADHD, autism, anxiety, or depression?
Um, we don't really have a common treatment. It's very individualized and tailor-made to that individual and that individual's needs and their goals for therapy. So it's a not one size fits all approach at all. It's completely the opposite. It's very individualized, and it draws out of me different parts of me when I'm working with somebody. Different parts of me come out with different people. Um, so it's not a technique or a tool. It's an approach. It's a way of being with the client, really. And yeah, together we explore. Together we go on a journey. Together we do the work.
So it's a combination of talking, seeing what's going on with the person, and then observing, feeling, being more like aware of what's happening from a sensation standpoint as well?
All of that, sensations in me, but also being curious about the sensations in their body.
Okay.
And where does that feel in the body? And how does that go? And what happens if that goes in and collapses, as we said before, this shame, and what happens in the body when you experience that shame, the first time you experience shame, where is it in the body? Well, it's here in the chest. And what happens to the chest? The chest retreats, the chest collapses, my head goes down, my arms fold in, my body curves. um, and the phrase that comes to mind is hanging my head in shame.
Yeah, we were talking about that before we went live. Like, I think that's just so interesting. My work is with personal training. I work with clients online. A lot of people come to me for back pain or shoulder pain or neck pain, and I really look at the environmental impact
Mm,
of movement. And a lot of the times we focus on just offsetting and manipulating their environment in a positive way. Because if people are in a default mode, they're sitting too much, most likely, and then all of the kind of wrong decisions are easier to make because overly processed food is overly abundant. You can open up a pack of crisps and eat it. You don't need to cook. It's very easy to do all the wrong
mm.
things. It's easy to just sit all day, order Uber Eats with technology. So we focus on making small little environmental tweaks so that people that I'm working with like move more. They're in positions where they're not closed off with their chest and tight and everything. I'd love you to talk more about that because that this kind of like what have you seen the impact of posture having on people from a mental health standpoint, from a how they feel overall standpoint?
Well, people are on their phones a lot, and when I look at my phone, I have to bring my head down. When I bring my head down, I have to bend over. When I bend over, I collapse my spine and my chest collapses, so I don't breathe so easily. My hands aren't available to me for manipulating the environment for expression. The focus is all down and in, and that must have an effect. That particular posture, if you're in it habitually, that must have an effect on your feeling state. Just like if I'm on the Titanic like this, the front of the Titanic. What's her name? The one that did that.
Oh yeah, yeah,
Actress.
yeah,
What was she?
yeah,
She did this.
yeah. So
This
just
is
for
like the
people,
winners. What was her name?
I can't remember,
I
but
can't
just for
remember
people
her
who are
name.
listening,
She was
uh,
doing that with her arms out and up, and it was the
yeah.
winner's pose. It's the winner's pose. Um, that gives you a feeling, doesn't it? It gives you a body state if you do that. Oh, yeah.
So Helen has
Um,
her hands open just for people listening, like, and it's very and just as you're doing that, it's very much like you're open, you're not closing yourself off. So I guess also like people being more not as social or not as expressive, like it makes sense that if you're closed off and you're on your phone, you're
mm,
retreating a lot with your posture, it would seem.
yes, indeed. You're isolating yourself away from interaction into the phone, just into the phone and texting and so on. Not even talking anymore, just texting, texting, or just not even phoning someone up. We don't do that, do we? If we're between 18 and 35, apparently. We just switch the phone part off.
Yeah. Yeah, this is super interesting. I haven't really thought about it this way. And I look like everything is a skill, you get good at what you repeat. So if you're like this really hit me when I was living in Southeast Asia for 2 years in my mid-20s, and I thought I was a fit guy, but I couldn't sit on the ground without pain. I would sit on the ground for 30 seconds, my hips would be sore, my back would be sore, my knees would be sore. And I was looking at everyone around me and they were just sitting no problem, and they were able to squat perfectly because they're using the toilet, a squat toilet. They're sitting on the ground having their meals. So from birth to 80, they're doing
Mm,
that every single day.
mm,
So
mm,
they get good at it. And
mm,
in Ireland and England and a lot of the West, we go into a chair. So then our joints stiffen up and we just
mm,
get used to this locked position. Um,
indeed.
so have you seen actually, because I was talking to Kit Lachlan, who he'd be in his 70s, and he's a really very well-known flexibility teacher. He's been teaching for, I don't know, 30 or 40 years easily. And he was saying he noticed a big change in people's strength over the last, 20, 30 years just because of sedentary lifestyle. Have you seen any sort of reduction in, people's movement or how they're behaving because of environmental shifts with technology and the world?
I can't say I've done a study on that. No, I mean I do teach online. I do have my training that I give to experienced psychotherapists online. We do a lot of experiential and we do a lot of movement in it. But even so, as we are here, we're just staring at this rectangle, and I'm only seeing half your body. I'm only seeing a quarter of your body, actually, just up to here. So I don't see the whole person. I don't know what your legs are doing. So the actual interaction non-verbally is almost non-existent, really. Yet it can work. Yet there is a possibility of empathy. There is a possibility to to gain a learning experience through the rectangle, through half the body. So when I'm working with somebody in authentic movement with a client, they go into the space, and I see their whole body, and they stay within the space that they've demarked in their lounge or wherever they're moving. And I see their whole body. But sometimes they move out of that place where I see their whole body and underneath the camera, and I can't see them at all. Or they move to one side outside of the rectangle. I can't see them at all. And I miss all of their movement. And so then when they come back and they ask for witnessing of their movement, which is part of the process, I have to say, I'm sorry, but I couldn't see anything because all I saw was an empty screen because you disappeared. I mean, they're moving with their eyes closed, so whether that's intentional or not, there's a part of them that doesn't want to be seen, that wants me
Mm.
to see them not being seen, you know,
Hmm.
because whatever happens, there's going to be sense making out of that. Um,
Yeah.
and I don't know whether that answers your question, but I can't say I've done a study of people's restricted movement. I imagine it is more restricted if people don't make an intentional effort. But people will in my practice, people will move their whole body, go into the space, move their whole body, unless there's a self-consciousness about it. And some people come for movement psychotherapy and they don't move because they can't go into the space. They just can't. It's too
Hmm.
scary. But we address that. We work with that.
Yeah. I saw when I was doing research on your background, you've been cited over 2,000 times. So you've got a, from a university, it's very head-based, like research, all of this, in general, like people who are in this space, but your work is very physical. So how has that been since the 90s or the 80s when you were putting out these ideas about movement? It must have been so new because it's new now. So
Oh my God.
how has that journey been?
That's so interesting you mentioned that. The Mental Health Week this week, Mental Health Week.
Oh, I didn't know. I
Yeah,
didn't
it's
know.
Mental Health Week. And you know what the theme
Oh,
is?
what?
Movement. Hooray! We've made it.
We made it.
Finally, we've made it.
Yeah, yeah,
It's
yeah.
such a
We
joy
took.
to have seen that. Um, yeah, it was really edgy stuff. Yeah, trying to make the argument. That's why I went into research, really, to make the argument. I was working with young offenders for my MPhil. And I used to go into this lockup and work with them, individually or in small groups of four. And I kept on pinching myself. What am I doing? I don't know what I'm doing going in. It's ridiculous. It's not making any difference. But I had to do it because I planned to do it for my research. And so part of the research was asking them what the hell was happening in those sessions with Helen. Somebody else did the interview. They were playing pool with them actually and talking to them about it. And it came down to really simple. What we did, well, we just moved about, we moved about, we moved about, and we talked. And then we did some more moving about and some more talking. That was all we did, really. So that was the sort of essence of what they found they did. Not that it was beneficial or helpful in their view. It was just moving about and talking. I mean, I don't think it made any difference to their career as offenders. A lot of them did end up in various prisons all over the country. But I do remember those sessions, and they did have a significant impact on me. And I must say, I must believe, I have to believe it had some sort of significance for them as well. Maybe I'm kidding myself. Um, I don't know. That answers your question.
Yeah, I guess like a lot of the times it's just the obvious. It's like the stuff your grandparents would have said as like taken for like why wouldn't you know the answer? I always look at it like looking at your dog. Like so you have a dog, the dog's acting up, it's getting, it's anxious, it's barking a lot. oh, I haven't walked the dog in a week or in 3 days. I'll bring the dog now and I'll walk him so he's tired. The dog's fine. Like, there's no
Mm,
problem. I
mm,
find that a lot. Like if you're feeling grumpy, like the HALT acronym, hungry, angry, lonely, tired is a good one as well. But um, generally, like doing some sort of physical output is, if that's not in your lifestyle or routine,
mm,
you probably shouldn't be feeling good
mm,
psychologically if you're not being
mm,
physically active. Like
mm.
you're built to move as a human being.
There's masses of research about physical activity and the effects of it on mental health, particularly on anxiety and depression. It's out there. With the work's been done, and of course, in the work that I'm doing and my colleagues do, we are working with the physical body. We are moving, but we're not moving with the objective body. We're moving with the subjective body. So it's from the inside out. It's not from the outside in. So it's not like going to the gym and walking. It's not on the treadmill, you know what I mean? Or doing the push-ups or whatever you do in the gym. It's not that way. It's not outside in. It's not that way, objectifying the body in that way. It's working with the subjective self. So the subjective body, the feelings or the sensations in the body and expressing those symbolically and metaphorically. And that's what makes it so powerful, that creative aspect, which just physical movement on its own, although it's helpful, it doesn't go that deep. It can't go that deep, but it is helpful. Of course, it's helpful for mental
Can you
health, for all
expand the
health, for physical
subjective
health as well.
body, what you said about the subjective body in more detail?
Well, it comes from phenomenological theory, Merleau-Ponty. It's if you like, it's the felt body sense, working with that, the inner experience of the body felt sense. So if you have a symptom, I don't know, backache, you were talking about working with people with backache. What does that pain feel like? Well, it feels like this.
Hmm.
How would that be in words? It's sort of sharp, cutting, repetitive, or it could be
This is
ringing, sustained ache of some kind. But to go through the body experience first and then the language to it, then there's more articulation can happen. To experience the sensation of that symptom, what does that actually feel like? And then can the hands say what that feels like? Can they talk the talk for that particular sensation?
this what's coming up for me now is what you're saying there. It's like you're kind of sitting with the sensation and the feeling and then allowing it to pass through you versus trying to run away from it. Would that be right?
So you're absolutely spot on there, Connor. It is about, in the end, acceptance and self-compassion, body compassion. And that the TBMA training, the body mind approach training, does train facilitators to help people to work towards that. It's a process, it's a journey inwards, it's a journey to making a new relationship with your symptom, a different
Yeah.
relationship. And people say, what, you want me to go into my pain? I don't want to go into my pain, I want to cut it out. And people do have surgery and stuff like that. It doesn't make any difference. They still have the pain. They still have the symptom. It's not always pain, but um, yeah, I think it is
That's
about that. It's about staying with, and by staying with, you're offering an opportunity or an opening a space to really experience that, to really dwell in that, and then to help it to transform, help that to transform. When people say that their symptoms disappear after going through a group with somebody facilitating the body mind approach, it may be that the symptoms disappear, but that isn't really the goal of it. That isn't really the aim. It's a good side product, if you like, a good side outcome, side effect. But what we're aiming to do is to change the relationship, change the perception, change the way people experience themselves with the symptom so they can live better with it despite it being there, if you know what I mean. It's about self-management, really. It's about self-management.
It's so interesting because it's so similar to internal family systems, what you're talking about. Like what you just said there, I want to cut out the part of me that I don't want or that's, causing pain or I'm reacting and I wish this wasn't a part of me. It's so similar.
That's interesting.
Yeah, it's very interesting. And also I find personally like the when I sit with stuff, it passes. When I do avoidant behaviors or try and escape from it, it stays.
It's ironic, isn't it? It's
Yeah,
completely counterintuitive. I agree, going
Mm.
into the pain, in some ways it makes it less powerful and it
Yeah,
does reduce and I can tolerate and I can be with it and befriend it and align myself with it so it becomes my ally, my new friend, as opposed to my enemy. So for many people with these symptoms, they've been chronic for years and the body becomes the enemy. They just hate their body because it causes them so much distress. So changing
yeah,
that, that transforming that is can be really, really helpful. Really, really helpful.
yeah. I can't remember the exact statistic, but a lot of women who are very heavy, there's a strong link with sexual trauma.
Yes.
Um, and I would imagine a practice like this would be probably very helpful, but also really difficult to work
There
through
is,
that.
we've just trained a cohort of trainees in the body mind approach, and one of them was working in a clinic which worked with young women who've been sexually abused. And yes, she is starting TBMA groups with them. And there is also research to show that for women, pelvic pain and
Mm,
sexual abuse, those two go together. There is an actual association between Wallinger, I think, did that research where the pelvic pain is unexplained, don't know what's wrong with it. Everything's normal, but actually, way back there was sexual abuse, and that's what the pain's about. So trauma can
yeah,
can be very much embodied, and for
yeah.
many of our patients with these symptoms will have some kind of a trauma in the background that somehow are related to, not always, but sometimes are related to the symptom.
And these unexplained symptoms, like fibromyalgia would be in that category. I can't remember like
Chronic fatigue,
autoimmune conditions.
yeah, IBS, chronic fatigue,
Yeah.
chronic pain, really, headache, backache.
Is there any research on the link with like early childhood trauma with this
Yes,
stuff?
there is Guthrie did some research. Guthrie and her colleague, can't remember the other colleague's name. They did some research which did link uh, insecure adult attachment to MUS generally. So did some research on that, and when we read that research and looked into it, we thought we could probably devise our body mind approach to take account of the insecure attachment. Not that everybody with developmental trauma like insecure attachment will have symptoms that or necessarily linked to symptoms, but we thought, well, at least if some people who come have that, we will be, beginning to address that a little bit in the way we design our group work. So we train our facilitators in the link between insecure adult attachment and developmental developmental trauma. We call it developmental trauma, and these unexplained symptoms. We do train our facilitators to take note about that and to ensure that when they're delivering their group practices, that they'd be aware that some people will be very resistant and some people will think that they've got all the answers and idealize them and think they're going to cure them. And other people will be ambivalent and so on and so on. So people can be aware of that. The facilitators can be aware of that. They can be ready to address those dynamics when they come up in the group.
What is MUS?
What is MUS? It's
Hmm.
defined as Edwards defines it really nicely, is a social predicament as well as a personal predicament in which neither the medical profession or the psychiatric or psychological profession can find any cause. It's no organic cause at all. All the tests and scans come back as normal.
What does it
And it's
stand for?
medically unexplained symptoms.
Ah, gotcha. Okay.
But there's lots of terms. I mean, the first term, if you go back to Freud, hysteria in women, um, if they presented with these symptoms, they were hysterics. It was nearly always women
Mm.
back in the Victorian times. And then it went into the term psychosomatic conditions, which is still used on the continent, but we tend not to use that now because patients found that very, kind of putting them down, that it's just all in your, imagination. You don't really have any symptoms because there's no there's no cause for these symptoms, so it's just all in your head. And they didn't like that because they really do have a pain in the back, you know,
Hmm. Yeah.
and they really experience that. And then another term is functional disorders because it affects your functioning, so your movement, if you like. Another term is somatization. Another term is medically unexplained physical symptoms. In fact, I was just talking to my colleague about a title for our new book, and we thought we'd call it Physical Symptoms Without a Cause, TBMA, and then lots of question marks all over the cover.
That's great. How do you thread the line? Like you've got so much knowledge, and from a research standpoint and practical application with clients between like looking at, okay, let's look for the trauma from the childhood versus a simple thing like, oh, this person just needs to move more. Like, how do you thread that line? Is it like a checklist and get them to do the basics first, and then that's not working and you focus on deeper stuff, or how do you approach that?
No, because the movement element comes out of what we're addressing verbally. So, or it might be that people come into the consulting room if I'm working face to face. They might actually come in saying, "Oh, I feel so anxious. My heart's beating so far." They come in with a physical sensation. So it's either way. Sometimes they present with that. Sometimes it comes up out of what we're sort of discussing with each other. There's no checklist at all. No, it's not as simple as that. It's very complex and entangled, all of this.
And I
Very
guess
complex.
if I went to a doctor and I was like, I've all these symptoms and they do tests and they're like, oh, there's nothing wrong with you. It's in your head. Versus I go to someone like yourself and you're like, okay, well, let's see what's going on in your chest. And let's
Mm,
actually just work through that. I could see that at least I'm being heard and I'm like, that's something I can work with as a patient, right?
that's right. It's very validating for patients when they feel listened to and heard, and also it's a group approach. So it's not one to one. The actual training is for group work. So because it's cost effective in the NHS, for example, when we're working in the NHS, it's so cost effective to work with 6 or 7 people in one group as opposed to individual one-to-one. So it's a 2 hour group process. And because they're working with other people, other patients who have symptoms, maybe not the same symptoms, it's quite heterogeneous group, but they all have symptoms that come back, nothing wrong with you. No news is not good news. It's living with the unknown. It's living in uncertainty. They're coming together with other people so they don't feel so isolated. They can talk with other people about their experience in the NHS. We don't give a lot of time for that. 5 minutes maybe only, because otherwise it would take, every single session. There's 12 sessions in a program. And, we're scaffolding them in from session 1 to right through to the ending in session 12, where they go deeper and deeper and deeper. And they work with each other. They learn about themselves through each other. They learn about themselves through the gateway of their symptom experience.
Yeah, do you know Michelle Sager's work on mindfulness, self-compassion?
I have heard of it, yes.
She has mindfulness versus over-identification, common humanity versus isolation, and
Yeah,
self-kindness versus self-criticism. But like
nice. Yeah,
the common
very much.
humanity is so helpful.
So
Like,
helpful. Yeah, yeah,
yeah, realizing you're one of thousands, if not millions of people experiencing something similar right now,
yeah.
versus like I'm this outlier, broken person. I think it's really
Exactly,
that's a helpful framework
exactly.
for people to think about.
That's why the group is so important. They all say afterwards, how important the group was. And in fact, most of the groups continue to meet for coffee, regularly to support each other. It was a sort of self-help group, but it was they made friends. They made friends in the group.
Yeah, that's huge. I'd love to hear about your own movement practice. What does that look like on a weekly basis?
My own, I do practice
Mm.
every morning before I log
Hmm.
on. And I also practice with a dyad with a colleague of mine whom I taught authentic movement to, and we have a monthly practice together. So I become a mover as well as a witness because otherwise I'm sitting as a witness all the time. I
Mm.
need to move. The witness needs to move too. So I become a mover in the presence of my colleague who becomes my witness.
And is that so? Obviously, that's that kind of somatic practice, checking in from the inside out, and like this kind of awareness practice.
It's
Is
a practice called authentic movement, the discipline of authentic movement. It originated in California with Mary Stark's White House, who called it movement in depth. She had an interesting Jungian psychology. And then it was developed, first of all, by one of her students, Joan Chodorow, who was a Jungian analyst who took the idea or the concept of Jung's active imagination. And instead of being active imagination making marks on paper, it was active imagination with your body. And another one of Mary's students, and I did meet Mary in 1978, and she's amazing, amazing woman, in a workshop, which is where the seed was sown for authentic movement. And another student called Janet Adler, sadly passed last year, she was my teacher, and she developed the discipline of authentic movement. She called it the discipline of authentic movement. It's a discipline, it's a practice. You need to keep doing it.
yes, and is that your entire movement? Do you do any sort of strength or mobility work or walking or anything else,
Yeah.
or is that your main practice?
No, I do go out into nature. I'm very fortunate. I live in middle of fields. I was brought up on a farm, so I've always been in nature, and I've always connected with nature. So I walk probably 3 or 4 times a week with my dog. Strength work, yeah, I probably could do a bit more of that, maybe. I probably could do a bit more of that. I do a bit of it in the morning practice, but I could probably do with some more.
Yeah, for sure. Um, well, yeah, we can talk about that if you want some tips there. Uh, let's talk about practice to finish off with. I think that's a really important concept to understand that, what you're talking about, what I talk about with clients as well. It's like it's not like you look at something or do something once and you've mastered it. What do you do with the people you're working with to get them to understand that this is like I guess this is like playing an instrument, or the more you practice, and you'll get better over time, and you'll get more, I guess, self-aware as well with this.
Mm,
How do you teach people, especially in this kind of instant gratification world at
I
the
know.
moment?
Mm. Yeah, it's difficult. Sometimes clients don't want to move; they just want to talk, and that is their choice. I think. I'm not into the business of forcing this movement to happen. And some clients will move, but they might only want to move for 2 minutes, 5 minutes at the absolute most. It always is the client's choice how long they move for, or if they move at all. When I train people for 250, 225 hours, I think it is, of practice. I do say to them, after they've finished that great long training of being in training with me, I do say to them, keep your practice, keep it going, go find somebody to teach and just keep practicing it. It's not just with your clients you need to practice, but you need to be a mover too. And so if you can find a dyad to work with, so you can keep that experience fresh of being a mover, of going down, of being in that place, that inner place with your eyes closed and following the impulse to move or not, as might be that it might be that you don't move. That's fine. You're allowed not to move. Stillness is important too. So they follow whatever comes up. If they follow the impulse to not move, to stay still, then that's what's correct. But just to be in that role of mover is so important to keep
Yeah.
practicing that.
Yeah. And I guess just helping people turn it into a habitual behavior that they can keep doing.
Yeah, so it's about awareness again. It's about, as I move, as I'm in my daily life, am I mindful of myself? Is my inner witness alive sufficiently for me to be mindful as I make action, as I interact, as I am in the world? So it's cultivating that inner witness. That's the strength really in authentic movement is cultivating that inner witness to be present, in action, reflecting
Yeah.
in action, rather than just on action afterwards, after the event, but being in the event, in the action, and having the inner witness alive to that.
So what would be, I like this because this is very practical for people. Someone might be actually just walking now, or
Mhm.
commuting or something. So what would be some practical steps? I love giving people like actionable nuggets that they can actually just start implementing right away. For someone who is, they're commuting, walking every day for an hour, like what would be a few things that they can do to bring this practice into their day?
Hmm. Just be mindful of your breathing, how it supports your movement in your walk. And then breathing only through the nose as you walk. Where is your breath? How does it support your walking? So that's one very simple thing people can do. When you're walking, can you notice how you walk? Can you perhaps be in your feet when you're walking? Be in your feet. Attend to your feet as you're walking.
What do you mean by be with your feet?
Be, be, take your attention intentionally to your feet and experience that contact with the ground and the transfer of weight from one foot to the other as you're walking. What happens to your knees? What happens to your ankles? What happens to your hips? What happens to your arms? What's happening as you're walking? What's the motion that you can be with? So you're in the walking. It's called mindful movement, actually. It's what we call it in the body mind approaches. We do invite participants to become mindful in their movement. And this is developing also the inner witness in the action. It's developing that observing self, or Freud called it the
Mm,
observing ego.
yeah. As you were saying that, I started salsa dancing, I
Ah,
started Latin dancing last year and then this year as well. But it was so interesting because I've been a coach for 13 years. I've been training for 18, 19 years of, different types of gym training and martial arts and everything. But the dancing has been so humbling because literally what you're saying now, the teacher was like, you're kind of falling over when you're dancing. And I thought I would have, I've done all this like balance work in the gym. And then this new area, which is dance for me, I was like having to be hyper aware of what I was actually doing. So I'm like, oh, my feet are in contact with the ground. And I was like, wow, I'm so mindful now of how I'm moving or how I'm kind of leaning to the side
mm,
or like my balance is off because I'm tilted to one side and I'm falling over.
mhm, mhm.
um so I found it really rewarding, the salsa dancing. Have you
Mm.
found people like, have you done any research around partner related work or in the dance
No,
capacity?
I haven't. I did start a group with partners actually together. So people would come in couples, and we'd be changing over from witness to mover. We changed roles, and that was very fruitful because a lot of course, their history's in that, their whole relationships in that, and yeah, it was very, very interesting for them. But I only just did the one workshop. It was in Italy a long time ago. But I think there is potential there for somebody to do something around partner work and using authentic movement with people in dyads who are in already in relationship. And maybe
Yeah,
when they're going through difficulties in their relationship, might be helpful to feel more seen by your partner.
yeah, I find it like I was really surprised with the benefits I've experienced from like Latin dancing. One thing I found really interesting was I would be last year I was very busy at work and I would go to the class exhausted, really drained, and then the girl I was dancing with would be exhausted and drained. And a lot of times when two people come together with that energy, they pull each other down. We would dance for 5 or 10 minutes and all the energy lifts and
Mm,
we're smiling, you know? So it's
mm,
really super. That really just kind of set off alarm bells for me because I was like, wow, this is really interesting because there's not a lot of activities where you've got two negative energies. You do the activity and it turns into a positive force.
mm, mm.
And then we were talking about this on email a few weeks ago about like every culture has a dance practice, historically.
Absolutely. Well, apart from ours, apart from the Western civilization, who've decided it's not valuable or something. Yeah, it's always been in societies. It's always been there alongside music, of course. Um, yeah, it's been a healing art for as long as the human race has been on this planet.
Yeah, exactly. So I think it's definitely, and just with like, I moved to Romania. So like, I didn't know anyone here. And I struggled with loneliness a lot with, I think, a lot of people in 2020, 2021. I couldn't believe it. Like, just going dancing twice a week, basically, I've met a really nice community of people in a new place. Like, it seems to kind of fix a lot of challenges I see people have today.
It,
Human
it
touch
brings
as
people
well
to
and contact.
It
Yeah.
brings people together. It brings people in, as you say, in connection. We know from research that's been done in circles where there's music and there's people moving in synchrony as if they were one, that this brings out a great deal of cohesion and a great deal of feeling a part of something more than, something being created that's more than the individual. So it's creating something that's connecting people. And also, actually, somebody's research, Bronwyn Barr did a PhD on pain and working in a circle dancing to music, and she found that the pain tolerance increased substantially in her research. So people found that they were not so much in pain because they were moving in community with others who were all moving together in the same kind of way to the music, to the beat of the music.
Yeah, that's so interesting. It's also like if I talk to you about this 10 years ago, I'd be like, that's like woo-woo stuff. What are you talking about? It's so interesting, isn't it? Like now it's like it's got the clinical research is there as well. And it's super fascinating. It's where do you see things going like in the next kind of 5 to 10 years?
I think the wave is reaching its the mass collective um, what's the word where you feel you're getting to a mass audience now, beginning with ecstatic dance, conscious dance. All of this is
Yeah.
coming in. Five rhythms have been around a long time, but more and more people are recognizing how important it can be to express yourself through your body with others in a group setting, and how useful that can be just therapeutically, not psychotherapy, but just therapeutically,
Yeah.
for body and mind as a therapeutic thing, not within that specialist relationship of psychotherapy. That's something else. But I think more and more people are recognizing the importance of expressive movement, creative movement. Embodiment is such a big thing now. I mean, in
Mm.
psychology, you've got embodied cognition, embodied mindfulness, everything seems to start with embodiment.
Yeah. And we have the movement theme for Mental Health Awareness Week.
Yes, yes, yes. It's reaching a crescendo, that's for sure.
Are
Um,
you happy that you've been beating this drum for a long time, that it's kind of starting
oh,
to click with
there's more to
people?
do. There's more to do. There's more research to do. We need the research. Um, Without the research, really, you've got no leg to stand on. You need the research, and we need the clinical practitioners to tell us their case studies, to write about their work, to publish, and so on. Yeah, I think there's more to do. It's not we've not achieved as much as we perhaps could. I think there's a lot more to go. But anyway, it's a good start. I think we've got a platform now with the embodiment. I think that's it's just that everybody's trying to grab it for themselves. Everybody wants a piece of it, if you like. It's quite interesting to see the politics of it all.
Do you mean that there's not like a cohesion? It's more like tr people trying to take it as their own, is it? Or what do
Yeah,
you mean?
yeah, I think so. I think yes. I think we won't have ownership of it like we have had. Let's put it like that. Dance movement psychotherapists won't necessarily have ownership of embodiment anymore because other people from other backgrounds are using it. Psychologists and different people from different backgrounds are taking this and adapting it for their own work, which is fine. You can't have sole ownership of anything, but it's great that it's going beyond just one profession.
Yeah. I'm conscious of your time, and I know you're a very busy lady. You've got two books that you need to write. I'd like to finish with some rapid fire questions if you're okay with that.
Okay.
S-
Mm.
So, well, first of all, do you want to share maybe what the next two books are about? That's going to be book 13 and 14, which is
Oh,
pretty incredible.
um, what is the next? Okay, so the first one is called The Discipline of Authentic Movement. I think it's a practitioner's guide, it's going to be called. And that's a culmination of nearly 50 years of practice and publications. So I'll be updating a lot of my early papers from sort of 2002 onwards on groups, on supervision, um, on the adaptive form that I use in TBMA, the adaptive form of authentic movement. I think it's about 12 chapters altogether. Um, so that's that one. And the other one, as I say, we've not really agreed on the title, but at the moment we're thinking about physical symptoms without a cause, the body-mind approach. And that will be, well, we've got 13 chapters and we've got chapter on medically unexplained symptoms or physical symptoms without a cause. We've got a chapter on the body-mind approach and the program. And then we've got the training, a chapter on how we train facilitators to be able to deliver the body-mind approach in adult groups. We've got a chapter on quantitative research. We've got a chapter on qualitative research. We've got a chapter on personal construct psychology and depression in women in Taiwan, which I wrote with my PhD student some years ago. I can't remember all
Why
the chapters.
why is it specifically about women in Taiwan?
Well, because she was interested in women with depression, and well, first of all, she was interested to study conversion as a syndrome for medically unexplained symptoms. And then she moved on to, having explored that, she then found out about depression in women often have symptoms. And so she decided her research would be on non-depressive women and women in the same group, women with depression and non-depressive women in the same group. And she did a couple of groups where she observed all their movement and did an analysis of the movement. And she also explored how the body mind approach supported the women with depression particularly, and found that the depression lifted and the symptoms, not that they disappeared completely, but they were more able, because they felt better, they were more able to manage their symptoms. It's quite interesting. And she did it all under personal construct psychology, which is a particular methodology and approach.
Okay. I'd love to hear about your writing process. A lot of, like, I wrote a book 2 years ago. It was a very, short book, nothing super research heavy or anything like that. But what is your process? Because you're clearly prolific with your ability to write. Like, how do you like set up your week to get through your writing? And I'd love to
Oh,
hear your
I
tips.
schedule it into my diary. I have hours that I put in my diary, 10 till 12 or, 1 till 4, um, writing. Um, and I do have an idea. Well, these two books are a bit different because they are bringing forward other material and adapting it and updating it. So it's not completely from a blank screen, if you know what I mean. It's not completely new writing, but my writing is stimulated by reading what I did before and saying, oh, well, that's moved on from there. Need to update that bit,
Mm,
and then there's more research, more recent research that's come out that we need to put in as well. So it's a bit different from writing from scratch, which I think you're talking about.
yeah, but you made a good point there about like scheduling it into the calendar. So that's when you have your blocks of time that you write, and then obviously your process is different. You're updating stuff that you've learned based on previous knowledge.
Yeah, yeah. For these
Okay.
books, I am. Yeah, yeah.
That leads nicely into the next question. What's something you've changed your mind on recently? And we'll talk maybe in the last 2 or 3 years.
What have I changed my mind on? Wow. Well, the thought I had this morning, and I said it to my colleague, if people talk about medically unexplained symptoms and they're medically unexplained, maybe they're psychiatrically explained or psychologically explained. So I don't want to use the word medically unexplained anymore. I actually would, that's why that new title came up. I really
Can
don't want
you
to
uh,
use that term.
can you unpackage that and explain what you mean?
Well, if you're saying something's medically unexplained, you're saying there's no organic cause. There's no diagnosis, bodily diagnosis for that symptom. So if there's no bodily diagnosis, then must be something psychologically or psychiatrically wrong. That's what the cause is then. So they send people off
Mm,
to CBT, so cognitive behavior therapy. That's the sort of next step logically, isn't it? If it's not medically explained, it must be psychologically explained. So we do split people into these two categories, physical health, mental health. And I think that term medically unexplained symptoms does make us do that. If it's not medically explained, well, maybe it's psychologically then. So we go down that path instead. And actually, our patients don't want to go down there because they're not mental, they don't see themselves as having a mental health condition because they've got a pain in their back. So why
mhm.
would they want to go down the mental health route? So they completely reject any therapy as such, which is why we designed this approach to be a course of classes, which is about learning and transformation, not about therapy as such. It's transformational learning using adult learning theory and self-management theory.
And you've changed your mind on that in the last 2 or 3 years, you'd say?
I've changed my mind about it this morning about using the term medically unexplained symptoms. I don't think we should use it because I think it
Yeah.
plays into the argument that it must be psychological then. And if you say it's psychological, our patients won't come to TBMA. They won't come. Because if I remember one patient saying in one of the groups saying, if this is about mental health, I'm not staying. And it wasn't even promoted as mental health. But if it is, I'm not staying. That's the attitude. The explanatory model is physical. I've got a physical condition. And they have. They have.
Mm.
Quite
And
right.
also, I think just it doesn't make any sense to be like, well, you've got two separate things here. You've got your physical health over here and your mental health here, and they're not correlated at all, which is completely crazy. Like that
I
doesn't make
know.
any sense. They're just
Because
health.
we're one person. We're one
Yeah.
person.
Yeah.
But I'm split into, neurology, you know, cardiac, heart disease, I'm split into, what are the other ones? I don't know. I can't even think. Gastroenterology,
Yeah.
all the ologies, all the
Yeah.
specialisms, I'm carved up. I'm carved up. But actually, I'm just one whole human being. and the physical and the psychological are meshed, very much so. And that's why I call it the body-mind approach. Well, actually, the patients called it the body-mind approach because they said it's all about linking my body with my mind.
Yeah.
That's what I've learned. It's about linking the two, so bringing the two together, not either one or the other, not separating them out.
Yeah. And I like the way like learning, just like learning and transformational. I can't remember the exact term you use, but it's just more like
Adult learning theory, transformational learning theory, and self-management theory, bringing those three
self-management.
together.
Yeah. That's so much better than, yeah, you need to work on your mental health, or, it's,
It's more
yeah,
accessible for people,
yeah,
much more accessible. And they like that it's different. They like that we make marks on paper sometimes. They like that we do writing sometimes. They like that we do expressive activities. It's different.
yeah. I think it also just like well, I think I told you in the email, like my mother is schizophrenia, or she was diagnosed with schizoaffective disorder like 30 years ago. And that's a really terrible label to be put on you. Like, you're schizophrenic. It's, oh, it's one of the worst things you can be probably called. Um, she started doing internal family systems therapy a year ago, and she's got no symptoms anymore. Like,
Wow.
it's crazy.
Fantastic.
So it
Fantastic.
makes me question everything about the treatment and about belief systems, how powerful they are, especially when someone in authority is telling you you have this thing and that's just the way it is. It's very disabling, that kind of label.
Very disabling, very limiting. And it become
Yeah,
and it's you have to be very careful it doesn't define you as well.
exactly. Yeah. So that's kind of another, I think, an entire other episode to talk about something like that. But thank you so much for just sharing your knowledge. Like, it's just been such a pleasure talking to you today. And I think a lot of people are going to benefit greatly from just hearing your opinions and everything you have to say in today's podcast. Where
Well,
can
thank you.
people, yeah, you're more than welcome. Where can people learn more about like what you do, or if they're interested in maybe courses or
If yeah, yeah,
your everything?
if they're interested in my authentic movement training or just coming along for out of interest, they don't need to train. They can just come along for them for their own education. I've got a website called Authentic Movement Circles blog.
Okay.
And if they want to know about the body mind approach, they can just, well, they can either go on the Hertfordshire University website called hearts.ac.uk
Yeah.
/pathways and then the figure two well-being,
Okay.
pathways to well-being.
We'll link all
Um,
that in the show notes so people can click through.
okay, so and there are facilitators on that website. We've got over 100 trained facilitators all over the world that they can contact if they want to have um, some input on the body mind approach for themselves. So there's classes all over the country now and all over the world actually.
Amazing. Amazing, Helen. Yeah, just really appreciate you connecting today and sharing your knowledge. Okay.
Well, thank you for the invitation. It's been a delight to talk to you, and I loved your questions. Fantastic.
Great.
I didn't feel too
Fantastic.
put on the spot. You did a very good job. Very good job.
Right.
Thank you.
That's good to hear.